Have you been diagnosed with rheumatoid arthritis? Or has a family member or a friend been diagnosed and you would like to know more? Then this is the video for you. Rheumatoid arthritis is also known as RA. You may be wondering, what is rheumatoid arthritis and how will it affect my life? Well, RA causes joints in the body to swell, which leads to pain and stiffness. It can make it hard to move or do the activities that you enjoy, such as bathing, dressing, driving, cooking, and grooming. What does RA do to your joints? You may be wondering, what is a joint? As seen in this picture, a joint is where the end of two bones meet. In a joint, there is a type of tissue that helps the bones move smoothly. In RA, that tissue becomes swollen and thick. In severe cases, this can make the joints crooked. When a joint is crooked, it makes the muscles weak, which can make it hard to move or to complete daily tasks. RA can happen in any joint, such as the fingers, thumb, neck, jaw, hips, knees, shoulders, elbows, wrists, and ankles. RA is caused by a problem in your immune system, which means that it can happen quickly and it can lead to problems throughout your whole body. What are the symptoms of RA? Well, as we learned earlier, RA affects the joints, which causes symptoms that include pain and stiffness, which can last more than 30 minutes after waking up in the morning or after a long rest. It can also cause redness and warmth, as well as swelling. RA usually affects joints that are on both sides of the body at the same time. This means that if the right hand has rheumatoid arthritis, then the left hand will most likely have rheumatoid arthritis. These symptoms can make normal movement difficult or uncomfortable. They often appear first in the wrists and fingers, then move to the elbows, ankles, feet, and toes before they move to other joints. What are other symptoms of RA? Well, RA symptoms can come and go. Some days may be better than others. The other symptoms include dry eyes and mouth, fatigue or tiredness, lumps under the skin, a mild fever, numbness or tingling in the arms or legs, and a poor appetite. Flares are times when symptoms get worse, and remission is times when there might be fewer symptoms or none at all. Nearly half of people living with RA may be able to achieve remission. This is because of improved treatment options and the ability to begin targeted treatment right after you have been diagnosed. You're probably wondering, who gets rheumatoid arthritis? Well, women are more likely to get RA than men. RA usually happens between ages 40 to 60 years old. It is not contagious, but it is a common type of arthritis. How is rheumatoid arthritis diagnosed? There is not a true test to diagnose rheumatoid arthritis. It can be hard to diagnose because its symptoms are like those seen in other types of joint diseases. Many RA symptoms are not obvious right away. A diagnosis is made by your doctor, who uses many types of information to find what your diagnosis is. It will look at your signs and symptoms, such as joint pain and swelling and morning stiffness, a physical evaluation of your joints, skin, reflexes, and muscle strength, X-rays, which can show if you have joint damage, and a blood test, which can identify problems in your immune system. What are the stages of rheumatoid arthritis? Stage 1 is early stage of RA. Symptoms of joint pain, swelling, and stiffness begin. Stage 2 is moderate stage, where swelling in the joint begins to damage the joint itself, and you begin to lose some movement. Stage 3 is severe rheumatoid arthritis. Swelling starts to damage the bones of the joint. Feelings of pain and swelling are common, and you start to lose strength and movement in your joints. In this stage, the joints start to become crooked. Stage 4 is end-stage RA. Swelling stops and the joints stop moving. It is as if the joints are frozen. Pain, swelling, stiffness, and loss of movement are the main symptoms in this stage. What are treatment options for rheumatoid arthritis? There is not a cure for RA, but symptoms can be managed. Many people choose to have surgical treatment. Surgery does not stop RA, but it can help reduce pain and improve movement. Medications are also an option to help treat RA. Medication can help reduce pain and manage swelling. Lifestyle changes can help you manage rheumatoid arthritis. First is physical activity, such as walking, swimming, or yoga. Regular, gentle exercise can help keep your joints flexible. Staying active can also help the rest of your body stay healthy and help you maintain a healthy weight. This can lessen strain on your joints, and exercise is a good way to relieve emotional stress that might make symptoms worse. Second is daily tasks. Joint pain and swelling might make it hard to complete daily tasks at home or at work. You can make small changes to help make daily routines safer and easier. Sometimes living with RA can be a challenge. Tasks that used to be simple might now be difficult. You might feel angry or frustrated, and this is normal. Third, emotional health. Being aware of your feelings can help you manage your emotional health and improve your physical health. For example, stress can make it hard to deal with the daily challenges of living with RA. It might also raise the risk of flares. You can take steps to understand and control your stress. Find out what causes your stress. Try keeping a journal or diary to help you find possible sources. Try to avoid things that cause you to have stress, and always make time for the things that you enjoy. Finding positive ways to cope is important when living with RA. Share your feelings with friends or family members and create a support group. What are the main goals for treatment? The main goals are to reduce swelling, improve your ability to move, and relieve symptoms of pain. Every person's story with rheumatoid arthritis is unique. Early treatment and good lifestyle choices can help reduce RA symptoms. Here are some facts about rheumatoid arthritis. Number 1 is to respect pain. When you feel pain in your body, then your body is telling you to stop and take a break. Number 2 is to avoid fatigue, which is feeling tired. Listen to your body and know when you might be overworking your joints. Number 3, ask your doctor or therapist about helpful exercises that can help you manage your symptoms of RA. Number 4, do not put pressure on swollen joints. It is important that you're not weight-bearing on your joints that are swelling or having pain. Heavy exercise can make RA worse. RA cannot be prevented. At this point, you may be wondering, is there something that can help make daily routines easier while living with rheumatoid arthritis? Adaptive equipment can help make activities of daily living easier, such as dressing, cleaning, writing, eating, bathing, cooking, and driving. Occupational therapy helps people get back to the daily activities that they enjoy. Occupational therapists are professionals that are skilled in adaptive equipment. There are several pieces of adaptive equipment that can make life easier, which will be shown through the rest of this video. Adaptive equipment in your home. As seen in this first picture, this piece of adaptive equipment is called an easy key turner. It increases power for turning keys with minimal stress on your fingers. It snaps over any standard key, such as your house key, and it's great for individuals who have rheumatoid arthritis. This piece of adaptive equipment costs $4.22, and you can find it at Walmart. You can also ask your occupational therapist for alternatives to making this piece of adaptive equipment. Next is the doorknob grip. The doorknob grip makes it easy to open doors, especially for people with rheumatoid arthritis. It is also keyhole accessible, so you can still use your key to lock and unlock your door. It's easy installation because it stretches over your doorknob. This costs $5.67, and you can find it at Walmart or ask your occupational therapist to help you create one. As seen in the last picture, this is called a lever handle. These lever handles are preferred to have in your home because it helps your hands open and close doors without putting too much stress on your fingers. Adaptive equipment for dressing. The first picture is of Coiler's elastic shoelaces. These help put an end to tying your shoes. It is ideal for anyone finding it difficult to bend or who have issues with rheumatoid arthritis in their hands. Once in place, just pull to tighten, and these elastic coils keep shoes secure, yet comfortable. Coilers are available in a variety of colors, and they will fit in any tennis shoes that you own. These cost $2.95, and they can be found at the arthritissupplies.com store. The next picture is of a button-aid zipper pull. People with rheumatoid arthritis or limited use of their fingers and hands will benefit from this double-duty button-aid and zipper pull. The built-up soft grip rubber handle is more comfortable for gripping. The formed wire buttoning aid pulls the buttons easily through the buttonhole. The brass hook at the other end easily pulls zipper tabs. This costs $9.95 and can be found at the arthritissupplies.com store as well. The next picture is a dressing aid stick. This simplifies putting on or removing clothing, and it comes with 2 loops for retrieving items. The hook stick has a section meant for assisting with zippers as well. This costs $9.20 and can be found at Walmart. If you talk to your occupational therapist, they can find ways to create these items for you or help you find them in locations closest to you. Bathing, toileting, and grooming adaptive equipment. The first picture is a long-handled bath sponge. This helps people get to hard-to-reach places when they have limited movement in their joints, such as in their hands. This costs $9.99, and you can find it at Amazon.com. The second picture is a long-handled brush and comb set. This costs $26.95 at arthritissupplies.com. You can ask your occupational therapist to help you build a built-up handle for the brush that you are currently using. The third picture is a long-reach comfort wipe. This costs $7.19, and you can find this at Amazon.com. This piece of adaptive equipment helps individuals when they have difficulty reaching to wipe themselves. This has a unique release button for fast sanitary disposal. It has flexible ends that grip the toilet paper. Adaptive equipment for eating. The first picture is a built-up fork and spoon. This costs $5.17, and you can buy this from Walmart. Your occupational therapist can also create built-up handles for your eating utensils. This helps individuals with rheumatoid arthritis who have difficulty gripping on to items. The second picture is a scoop plate. This costs $5.75, and you can buy this from Walmart. The inside scoop section is designed for easier self-feeding, with a unique curved rim to help guide more food onto forks and spoons. This also has a suction base to avoid slips and slides. The third picture is a lightweight T-handled mug. This costs $8.95. You can buy this at caregiverproducts.com. The T-handle mugs are adapted drinking cups that have a unique handle that is easy to grasp. The T-shaped molded plastic handle slips between the first and second finger and allows the cup to be lifted effortlessly. This helps individuals who are having problems due to stiffness and pain because of rheumatoid arthritis. Adaptive equipment for cooking. The first picture is of a rocker knife. This costs $8.29. You can buy it from Amazon.com. The rocker knife creates a comfortable grip and easy use for individuals with rheumatoid arthritis to be able to cut food while in the kitchen. The second picture is a pot stabilizer. The pot stabilizer prevents a pot from moving while the contents are being stirred. This piece of adaptive equipment helps people not have to use two hands when cooking. This costs $11.95, and you can buy it from caregiverproducts.com. The third picture is a pre-slit foam pipe insulation. This helps create built-up handles for any utensils in any part of your home. This can help create built-up utensils for forks, spoons, and knives, as well as stirring spoons. This costs $3.07, and you can buy it in a pack from Walmart. Adaptive equipment for cleaning. The first picture is an extended handled dustpan. This costs $17.99, and you can buy it at Ace Hardware. You can also ask your occupational therapist to help create a long-handled dustpan individually for you. The next picture is of the pre-slit foam pipe as talked about previously. You can take this foam pipe and create a built-up handle for your broom, dustpan, duster, and many other items for cleaning. This costs $3.07, and you can find it at Walmart. Adaptive equipment for writing. The first picture is a grip write pen. This costs $3.82. You can buy this from Walmart. An alternative to the grip write pen is using a tennis ball and putting a pen through the tennis ball. The ball on the pen helps reduce stiffness and pain when writing in people who have rheumatoid arthritis. The next picture is a twist and write pencil pack. This costs $6.95 from the arthritis supply store. The next picture is a classic ring pen writing aid. This costs $10.95, and this can also be found at the arthritissupplies.com store. Occupational therapists can create an individualized plan to come up with adaptive equipment that can make your life easier while living with rheumatoid arthritis.